Welcome to Smart Health Tips, your trusted source for practical and effective health guidance. Today, we are diving into a crucial topic: how to measure your blood pressure accurately. Whether you're monitoring your health at home or ensuring precise readings for a doctor's visit, understanding the right technique is essential. Let's get started. Measuring blood pressure accurately is vital for assessing cardiovascular health and managing conditions like hypertension. To get reliable readings, it's essential to follow a systematic approach. First, choosing the right equipment is crucial. Automatic digital blood pressure monitors are user-friendly and often provide consistent results, while manual sphygmomanometers require a bit more skill but can also yield accurate readings when used correctly. Regardless of the type, ensure that the device is validated and calibrated according to manufacturer guidelines. Before taking a measurement, preparation is key. It is advisable to rest for at least 5 minutes in a quiet environment to ensure that the body is in a stable state. Physical activity, stress, and even caffeine can temporarily elevate blood pressure, leading to inaccurate readings. Ideally, the individual should sit comfortably with their back supported, feet flat on the floor, and arm at heart level. This position helps in obtaining a more accurate reading. When it comes to the actual measurement, proper cuff placement is paramount. The cuff should be wrapped snugly around the upper arm, with the bottom edge about an inch above the elbow crease. It's important to ensure that the cuff is the correct size. A cuff that is too small can yield falsely high readings, while one that is too large can result in falsely low readings. For individuals with larger arms, using an appropriately sized cuff is particularly important. Once the cuff is in place, it's time to take the measurement. For digital monitors, simply pressing the start button initiates the process, and the device will inflate the cuff automatically. For manual monitors, the cuff is inflated using a bulb until the pressure is sufficient to occlude the artery. The pressure is then gradually released while listening with a stethoscope. The first sound heard as the pressure decreases indicates the systolic pressure, while the point at which the sound disappears signifies the diastolic pressure. It's important to note that accuracy can be affected by the experience of the person taking the measurement, so practice and familiarity with the equipment can improve reliability. To enhance the accuracy of blood pressure readings, it is advisable to take multiple readings. Ideally, one should take 2 or 3 measurements, waiting about 1 minute between each. This helps to account for any fluctuations that may occur due to various factors. Recording the readings over time can provide a more comprehensive picture of blood pressure trends, which is particularly useful for healthcare providers. It's also beneficial to measure blood pressure at different times of the day. Blood pressure can vary significantly throughout the day due to factors like activity levels, stress, and food intake. Taking readings in the morning and evening can help in understanding these variations. Additionally, keeping a log of readings can assist healthcare professionals in making informed decisions regarding treatment and management. Finally, understanding the numbers used is essential. Blood pressure is expressed as 2 numbers, systolic over diastolic. A normal reading is typically around 120 E80 mHg. Readings above this threshold may indicate elevated blood pressure or hypertension, which can lead to serious health issues if left unmanaged. It's important to discuss any concerns with a healthcare provider, who can offer guidance tailored to individual health needs. In conclusion, accurately measuring blood pressure requires careful attention to detail, from selecting the right equipment to ensuring proper technique and recording practices. By following these guidelines, individuals can monitor their blood pressure effectively, contributing to better health outcomes and more informed discussions with healthcare professionals. Regular monitoring not only empowers individuals to take charge of their health, but also plays a critical role in preventing potential complications associated with hypertension. If you found this video helpful, give it a thumbs up, subscribe to Smart Health Tips, and hit the notification bell so you never miss an important health tip. Stay safe, stay healthy, and see you in the next video.